There is nothing more painful than watching someone you love be misunderstood by the world while they're still learning how to understand themselves. And yet we do it all the time to our kids. We see a brilliant, beautiful mind that doesn't move in a straight line, and we try to force it to walk according to everyone else. But the truth is, some of the most gifted minds grow like wildflowers, not factory crops. And no matter what we do, we can rush their blooming. So, who better to help us understand this than a man who has dedicated over 30 years of his life to studying and supporting those very children? He is the man behind some of the most influential books on executive skills ever written, a psychologist, an author, and above all, a champion for kids who think differently. Please welcome Dr. Richard Guare. Welcome, Dr. Guare.
Thank you very much, Bill.
It's such an honor to have you here. For listeners who haven't come across any of your brilliant books or aren't familiar with you, could you take a second, give us a quick introduction?
Sure. Myself and my co-authors, Peg Dawson and my son Colin, have been involved in this work for now it's 40 plus years, actually. And uh, I started as a neuropsychologist back in the early 80s when executive skills were really not even known about. Um, and through the evolution of research, first of all, in traumatic brain injury, and then subsequently around first children with ADHD, primarily by Russell Barkley and people like him, and then subsequently to typically developing children. The field has evolved enormously over time. Um, Peg and I, in particular, were interested since we were directing an ADHD clinic. We were particularly interested in the fact that we were seeing a lot of kids who didn't meet diagnostic criteria for ADHD, but still had some struggles. And that's where we ended up writing about executive skills in typically developing children.
And that's why we're here. That's exactly what we're gonna talk about in this session. So, Dr. Ware, can we start there? Like so many parents, f- ADHD starts for them, with a list of behaviors like distractibility, forgetfulness, impulsivity. But behind every behavior is a child, like I said, who feels deeply misunderstood, right? So let me ask you this. What damage do you think is being done when every correction is framed as a moral failure instead of developmental delay that really is?
Well, I think that the certainly children internalize that, particularly if it's framed as a moral failure. And I guess the one note that I would make is we've never treated that either as a moral failure or as a developmental delay, because for some children, at least, and for some parents, delay also carries its own negative connotations. And so, with our experience having worked with children, basically we're accustomed to the fact that everybody's got their own course of development, and everybody's got a particular set of strengths and weaknesses. And if you look at children as individuals, not in the context of some set of externally imposed norms and so forth, then and appreciate them in the skill sets that they have for who they are and the context they're working in, then that's probably the most effective way to think about children and to treat errors simply as errors, as mistakes that everybody makes and that are actually quite critical for learning and development.
True. Everybody makes mistakes, and that's crucial for development. Um, we also have this, cultural phrase that says kids are resilient. We throw it around like a shield, as it children can bounce back from anything. But in your experience, what would you say? How much of that early misunderstanding, actually lingers? How much it stays inside of them, shaping the adults that they become?
I think actually quite a bit. I mean, we have some clinical, actually quite a bit of clinical evidence for that. Having seen work with uh, teens and early adolescence and late adolescence, and then with young adults and adults, all of whom refer back to the fact that they felt since early childhood that in some ways they were incapable or even felt like they carried some sort of defect with them. And that's persisted and impacted the types of tasks they're willing to undertake, and certainly impacted their confidence about whether they're going to be successful at a particular enterprise or not.
Mm. And since you mentioned you have all of that clinical evidence and so many experience regarding that, what would you say? What's the biggest myth that you see parents, kind of clinging to? Something that they believe it's actually helping their child with ADHD, but in reality is making this problem even worse.
I think telling children that they have the ability to do something, and if they just try to do it or if they're just motivated to do it, then they'll be able to accomplish it. I think that that happens quite frequently, in particular because a lot of these children, as you mentioned before, they're quite talented. They have very good ability, um, and so parents see that and they assume that this is a really a issue of effortfulness or motivation, when in fact it's not.
Nothing to do with it, right? Right. And what about support? We all know that kids need love, they need patience, they need safety. That's the obvious. But considering the way the ADHD brain is wired, um, what's the thing that parents kind of overlook? The specific kind of support that those kids actually need us from.
I think there are a couple of things that are actually related to each other. One of them is appreciating that this is an issue of small steps. And so having expectations, for kids, to the extent that your expectations are matched to what the children's ability is and not to your own expectations, are absolutely critical. And along with that, rather than uh, uh, encouraging or rather than reinforcing or offering praise only with achievement, uh, to offer encouragement in terms of the effortfulness that children put into a task. So if you reinforce effort, if you praise effort rather than achievement, then kids are much more likely to persist in those kinds of activities and to ultimately reach success.
So the process itself, not the final outcome.
Yes, absolutely.
Mhm. And Dr. Guerrero, you had this unusual position, expert in executive skills on one hand, and a father of a child with ADHD on the other. Your son Colin, who is now an adult, I'm talking about. Did those two roles kind of complement each other, would you say? Or did they sometimes clash? How did that look like?
Both actually. There were times when they complemented each other. I mean, certainly early on, we recognized my wife's a teacher. She retired from a 47-year teaching career a few years ago. Um, Both she and I recognized that Colin was struggling in certain areas, and so early on we recognized that he had an attention disorder. In fact, Peg Dawson, my colleague, was the person who made the initial diagnosis. Obviously, it wasn't going to be me who was going to make the diagnosis. So we knew that, and in that sense, being able to recognize some of the struggles that he was having, um, those roles were complementary. On the other hand, um, my son Colin he's very bright. He's very well accomplished in a lot of areas, and so there were times when, looking at what he was capable of doing, I crossed over that line into a parent and became, uh, again, much more, at times critical, at times demanding. That if he just put more effort into something, then he would succeed. And so it depended on the context, but certainly around things like academics, um, where he was quite successful, particularly through elementary and through a good part of middle school. Um, my expectations remained quite high for him. And it wasn't until high school, particularly the latter part of high school, and particularly once he went to college, that I realized that my expectations were completely unrealistic.
Mm. Was there a certain, speaking of expectations, was there, a moment when you realized that, your child's developmental timeline was different, and that forcing me to meet those normal milestone was doing it more harm than good? Was there a moment in there?
I don't know that there was a particular moment. I think it depended on what we were looking for in terms of, or what we were expecting as far as skill set was concerned. As I said, we recognized in very early elementary school that his ability to sustain attention, his ability um, to remember on a consistent basis rules in a classroom uh, was a struggle for him, and in fact related to his ADHD. Similarly, with some of his academic tasks in writing, he struggled with writing early on. Um, I recognized pretty early that this wasn't a motivation issue. This was a genuine struggle for him because of certain executive skill weaknesses. In other areas, I don't think I realized until, as I say, high school, or certainly when he went to college, where um, with the support that he had, and with the support that most of these children have through elementary and through middle school and even through high school, where you've got parents who are available, you've got teachers who are available to provide and to prop up support for executive skills, that's not evident. But once um, uh, a child, an adolescent, goes out on his or her own, and they're expected to manage independently, I think that's when we realized how much of a struggle this was really going to be for him.
Shows up. Yeah, yeah, that makes sense. Um, and I believe, the society is brutal about measuring children against the norm, and that causes a lot of fear in parents as well. What fear did you have to confront? To finally let go of that pressure for your son to measure up to everyone else's timeline.
Well, as I said, I think you know my wife and I were in an advantageous position because of the work that we did. And so when we recognized that he had an attention disorder, a lot of those expectations about meeting developmental norms or meeting the norms of students around him, or peers around him, didn't really come into play for us at all. But I think that that was a function of our own background, and realization that he was going to develop his own way and in his own course. And I guess the other thing that I'd say is that Colin is a he's certainly an assertive individual. I mean, always has been, and whether that comes as a result of who my wife and I are, both of us are also, you know, fairly assertive individuals, and used to having control in situations. He made that clear early on that that was going to be his path, also, and so in a lot of ways that forced us to back off a little bit. I think it would be more difficult for parents if a child was more passive or less inclined to challenge them, because then you think that what they need is they need to be pushed, they need to be encouraged. When we pushed him and he didn't feel like it was appropriate, we certainly saw a lot of pushback from him about that.
Mhm. And when we were earlier discussing that it's not a matter of motivation, um, can you help us, understand the parents who are listening? Because I think it looks the same on the outside. How are you able to see the difference between a child being unmotivated and a child being stuck in the ADHD kind of way? Because I really believe that most parents, those two things kind of look the same.
Yeah, I think that that is definitely the case, and I think that as children get older, we hear more and more of that from parents and from teachers in schools, where behaviors that at an earlier age might have been understood as reflecting some, again, struggles with something like ADHD or executive skills, later on look more intentional or willful or behavioral, and I think that I guess what I'd say is that the way that we've thought about that is that um, there a lot of it has to do with the effortfulness of the task and whether the task is a good match or mismatch for the child. And so with whether it was with Colin or whether it was with children we were working with, we tended to look at what's the context that they're working in right now? What's the struggle in terms of the task? And is the struggle primarily because the task or the task demand is a mismatch for what the skill set of the child is? And in some cases, it is. And so a lot of my experience working in schools was that ta- children were basically mismatched. And so if you modified the task, what's in in behavioral psychology, it's referred to as antecedent control. But basically what it means is rather than looking for what the source of the problem is in the child, think about the possibility that it's the task that's difficult, and that if you're able to adjust the task, then it's more likely that children will be able to perform the task. So that's one element. The other element that I mentioned is effortfulness. And there are times when, and this is true for all of us, if you think about it, there are certain tasks that we know how to do. There isn't any question about whether we've got the skill set to do them, but we avoid doing them. And oftentimes we avoid doing them because for us in particular, that particular task seems quite effortful. And in fact, we've done many, many surveys with children as well as young as 9 or 10, up through adults, and said to them, give us a list of tasks that are quite effortful for you. And adults are always able to do that. They acknowledge that they have the skill set, but that doesn't make them any more inclined to be able to do the task because there's something about that task that's not a good match for them. And so I think you have to consider both of those. Is it a bad match, as far as the task demand itself? And also, is the effortfulness of the task for that individual so great that even if they have the skills, they're not inclined, or they're inclined to try to avoid the task?
Mhm. And here's another thing that I think parents often, struggle with. When a child knows what to do and still can't execute, how do we draw the line between true inability and deliberate resistance to that certain task, for instance?
For us, that's always come down to modifying the task first. And so, and again, in our work, and we're very explicit in our writing about this, that there are certain, if it's a question about if it's a question about the task, then before you ever think about motivation or whether this is a skill deficit, to go back and look at the task. Is the task, for example, too long? Is the task too complicated? Are there indications in the child's background that they've struggled with particular aspects of the task? And to go about and make modifications in the task, sometimes by making it shorter, sometimes by making it similar. And by virtue of doing that, by virtue of doing those kinds of things, does that enhance the performance of kids, make it more likely that they will adopt or adjust and complete the task? And we've been quite successful using that intervention in schools, where rather than assuming this is a motivation effort, assuming first that it was a mismatch in some fashion between the child and their skill set and the task demand.
Mm. Could you give us another example of modification of those tasks? You mentioning length, their surroundings. Can you give us a couple of more examples so that?
Sure. I think that, at an elementary level, one of the modifications that we made all of the time is, for example, if you have a child who balks at doing workbook pages, they get a workbook page, they have to do mathematics problems on a workbook page. Um, and as soon as the page is presented, you get anything from just kind of passive resistance all the way up to children acting out at times, we're just flat out refusing to do it. So one of the modifications that we always started with is reduce the task demand down to one or two problems. Are they capable of doing one or two problems on that? If so, then you modify the task in that way, and you basically set the task up so that you do task, very short task, break, short task, break, short task, break. So that's one way. Another way is to modify the problem itself. And so um, if I were to give a child a task where the task demands a certain type of calculation, maybe I simplify the calculation to see whether that that ability isn't so automatic for them, that they're able to apply it easily in these kinds of situations. And what we're looking for that kind of situation is, what can I reduce the task to a point where it looks easy enough for the child to attempt it and move on, and to build very, very gradually over a period of time, which helps to build a child's level of confidence. At an older age, we've done the same thing with writing tasks, where writing in particular, especially writing paragraph and story length writing, is particularly difficult for children with executive skill problems because of the demands that writing puts in particular on executive skills. And so we're always looking to make modifications in that task. Rather than writing a paragraph, it might be as simple as writing a sentence, or even not writing the sentence. For sometimes these kids have graphomotor problems, and so the motor execution of the writing is difficult. Rather than doing that, of having them dictate to somebody else a sentence that they're able to do, and gradually build on the task over a period of time.
Brilliant, brilliant. Got it. Okay, and then comes the flip side, Dr. Guare. We want kids to feel, ownership of their own lives. We tell parents, give them autonomy, let them choose their own goals. But here's my question: what if their goal, what if they choose the goal they choose is below their true ability? How do you validate a child's autonomy without enabling underachievement? Would be the question.
I think there are a couple of questions built into your question. One of them is, if you present a child with a task and you say that it's below their ability level, then my first inclination is to go back to what we said before, and to say, is the issue the nature of the task itself? And so I want to modify the task to see whether that's more likely to facilitate the child's accomplishment of the task. So that's one thing. I think another one is that, how is it that they got here in the first place? And if there are times when children will attempt to avoid tasks because they're expecting that they will fail in the task, or that they will be critiqued about their performance of the task. And so if um, if parents or teachers are in the habit of, a sense, micromanaging, or very, very are constantly monitoring the performance of a child and correcting that kind of performance in a way that feels to the child as if they're constantly being held to a standard, or they're constantly being blamed for their failure, then after a while they're much less likely to be willing to perform that kind of
Mhm,
task.
mhm, mhm. True. Um, Still, however, I think some parents also lower their expectations, their own expectation, just to avoid, constant conflict around what needs to be done and whatever. And I get it, because the in the short term, that peace or that calm, no conflicts feels really good, right? But in long term, does that peace come at a price of potential? What?
Sure, no question about it. I think that the if again, assuming a parent's estimate of their child's ability is accurate, and when they believe, when they know based on what their child's ability is, that the child is in fact underperforming, then for the parent, it's a matter of setting up an expectation to begin with about this is what our expectation is. Now, again, you might have to modify the task so that you can get the child to begin the task, but it's reasonable for parents to set expectations in advance in a proactive kind of way, and to let the child know both what the outcome will be if they're successful at doing the task, but also what the consequence will be if they don't do the task, or if they don't perform the task to a level that the parent knows that they're capable of.
Mhm. So communicated with a child of your expectations prior.
Absolutely, and for that communication to be explicit, to be very clear, for the parent to be very clear with the child about what those expectations are, and whether we're talking about, in that case, whether we're talking about academic tasks, or whether we're talking about other behaviors, for example, in the home, where parents have reasonably certain expectations. Now, because the situation that you bring up, parents will sometimes avoid conflict around that. They won't A child doesn't follow through with a direction that the parent gives, and parents leave it alone for fear that it's going to lead to some sort of a conflict. Ultimately, that never works. It's not effective, and so our preferred way of helping parents to avoid that, as I say, is to set expectations well in advance, to be clear about what the consequences are going to be well in advance, and then let the child, give the child the opportunity to perform the task, but if they don't, then let them experience the
Mm,
consequences.
mm, mm. Here's another thought. Do you think some parents lower expectations because it protects their ego as well? Because it's sometimes easier to accept that a child doesn't care than to face the truth that a child cannot do what we desperately want him to do. What's your take?
I I do think that parents do that. Again, that's the assumption in your question, is that parents really do understand that a child is not capable of doing a particular task. And so I don't ever want to put a child in a situation where I'm expecting or demanding that they do a particular task when I know the task is well beyond what their particular ability is. At the same time, I want to know, and I want to give children enough of an opportunity, again, by talking about the things that I talked about before, of modifying the task, to know exactly what that level of performance, what their actual level of performance is, and what they're capable of doing. At that point, I think that there are parents who are, again, if you have a children, for example, if you have a child with learning disabilities, then and I suspect, as particularly as kids get older, because certainly children themselves do this, rather than saying that they can't do a task, they say they don't want to do a task, and they do that to avoid the stigma of this being a skill deficit. Um, but in fact, again, I think if children have been in a situation where they've encouraged to perform as well as they're capable of performing to begin with, and they've had a lot of opportunities from parents and from teachers to be able to perform that way, then they'll stay on a track that they're comfortable with. Ultimately, if you don't have a skill and you're surrounded by people who have that particular skill, it's always going to be a struggle. But again, that then it becomes a matter of looking for what are some areas that work for me in particular, given my skill set, and where can I feel successful in those kinds of situations.
Mm-hmm. But you would probably agree that those expectations are kind of tricky. If they're too high, you mentioned earlier, kids blame themselves. They drown in shame,
Right.
right? If they're too low, then that might lead to stagnation. Um,
Yes, for sure.
where exactly is that, fine line where growth is possible without collapse?
Again, I think that the only way that you can know that is by very accurate estimate or appraisal of what kids' actual skills are. And once you know that, of if they're still resistant to do those kinds of tasks, then we're back to the question of, is it a matter of encouragement? Is it a matter of task modifications to get them on the path to success? But I think that it's critical to understand what the skill set of the child is and to not make those assumptions. I think that, as parents, sometimes, we're in a position to make fairly broad brush assumptions about what our kids are capable or not capable of, when in fact, you just, what you need is more information.
Agree. Dr. Way, you said that part of your job as a parent is to let your child take acceptable risks. Um, but how do we do that? How does a parent do that when every cell in our body wants to protect our child?
I don't have any I don't have an easy answer to that. I mean, I think that part of the role of being a parent is understanding that from the time your child is born, they're growing away from you. I mean, I've got a 4-year-old granddaughter. I've got a 14-month old. I got 14-month-old and 10-month-old grandsons, and I can see them. When my 14-month-old grandson began to crawl and pay less attention to his mom and dad, I hear from my daughter, his mother, that it already feels like he's moving away from her. And again, he's doing things. I watch them interact around the house. Like him falling down, him, crawling into areas where he shouldn't be. And I think that the if you understand the developmental levels of kids, you certainly don't let them you don't expose them to things that are genuinely a risk for them. They have a wood stove in their house. It's not a matter of, well, let's let them go near the wood stove and get burned and use that as a consequence. But at the same time, there are other kinds of opportunities for him. I watched him climb up a slide rather than come down the slide. And he kept sliding back down the slide and getting more and more frustrated or occasionally falling. I think that those are acceptable kinds of risks. And as a parent, about all you can do is live with that kind of anxiety about, do I understand my own child well enough to know what's an acceptable risk, what's not an acceptable risk. But beyond that, certainly once you get into middle school and high school, where you're talking about adolescence, the risks are real out there. They're genuine, and but at the same time, you understand that ultimately the goal of children through development is to become independent. And the only way for them to become independent and competently independent is for them to take risks, to make mistakes. Hopefully you're able to prevent them from the kind of mistakes that are catastrophic or, again, potentially harmful for them in terms of health or psychological well-being.
Mm. And their own independence, is that a reward, for letting go of our control?
For some people it is, for other people it's not. I think that I mean, that notion about an empty nest syndrome, I think that one of the hardest things for parents to understand is, suddenly my kids don't need me anymore. They're moving off on their own. They don't ask me about, they don't ask me for my advice, or if they ask me for my advice, they feel free to take it or leave it. I think that kind of independence comes with its own, it comes with its own benefits, and ultimately, yes, it is. I mean, my daughter is 32 years old. My son is 38. I love the fact that they manage it completely on their own. I still appreciate them asking for my advice occasionally, but it's a incredible reward to see your kids be able to grow to independence and be able to manage their own life successfully.
Mm. And on the flip side, as you said, also an emotional cost of letting go of that control, right?
Yes, for sure.
Yeah, yeah. Um, and what exact, developmental moment does a parent, would you say, have to step back, and risk letting their child fall? Not because they want to, but because protecting them any longer will guarantee dependency on them.
I think it starts with very, very young children. I think it starts when in the first 6 or 7 months where kids are completely dependent, particularly they're dependent on their moms for everything that goes on, for self-care, uh, for all of the necessities of life. But at the point that they start to show signs of independence. I would think for a lot of parents, that is movement. That's crawling, and then walking. Uh, at that point, you have to give them the opportunity to make mistakes on their own, and to treat the mistakes as simply that. We all make them. I know as I say, my son and my daughter, watching them interact with their kids, um, they're they're clear with their kids when to point out their own mistakes. Oops, I made a mistake here. Um, this is how I'm going to correct it. So modeling that for children, but also giving them the opportunity and letting them know that mistakes are correctable. Sometimes by providing a little bit more help, sometimes by simply providing a little bit more direction. But I think that's something that starts very, very early, and it really is critical to the development of the children. And you'll see the payoff comes in children's desire for autonomy and independence if that type of mistake making has been encouraged early on.
True. Okay, Dr. Guerre, for the end, I have a couple of rapid fire questions for you. Ready?
Sure.
What's the difference, for a child's nervous system between a parent hovering over them and a parent who's sitting quietly beside them?
I don't know about how this translates exactly in the nervous system, but I know behaviorally the difference is that when parents hover, children develop anticipatory anxiety, and so they live a little bit on edge all of the time, expecting that they're going to be either corrected or critiqued for their performance. And again, that's not something that goes away easily over time.
Right, right. Um, when a child rejects help, as control, how does a parent walk the line between collaboration and, complete permissiveness, like letting them do whatever they want?
I think that again, that starts very early with children. When children are not able to, again, thinking about infants and toddlers, when they're not able to do something, oftentimes they will come back to the parent looking for some sort of help. Our advice to parents has always been you provide the minimum amount of help necessary for the child to get back on the path to success, not to necessarily complete the task successfully, but to give them the feeling that they're capable of completing the task successfully. And so I think that that's the way that you manage it. We use a technique called prompting, where you provide a minimal level of support. The classic one is a child goes to open a door and they can't quite manage the door handle, whatever that is. And so you gently place your hand over, maybe over their hand or along their arm, and you assist with them. And as soon as they're on the way to turning that handle, then you withdraw the support so that they always know that you're not going to control the situation for them. You'll be there to provide some help, but you'll always back off once they're capable of doing that particular task.
Brilliant, brilliant. What would you say? What's the smallest unit of success a parent should celebrate, and why is it almost always smaller than they think?
We actually, as a behavioral psychologist, we measure this according to what children's baseline is. So if I look at what a child's performance is right now, if they do something that's say 10% beyond what their level, what their current baseline is, so for example, if a child is able to do uh, 10 problems, for example, um, then for me, the what I'm looking for the next step is the 11th problem, not to go from 10 problems to 20 problems or 20 problems to 50 problems. It's it's those very, very tiny increments that start with understanding what's the child's current level of performance and what's the smallest next step, not that I think that they're capable of, but that they think that they're capable of, and encouraging them to do that step.
When you look back, what's the most important thing you learned about ADHD, not from research, but from your own child?
If I had it to do over again, uh, I would be, I'd understand the struggles that he had better, and I'd be more patient about them. And also, now, at least in retrospect, I would encourage the small steps, the tiny steps of performance, and encouraging that kind of uh, small step performance, and not being so much committed to my own expectations about what he should be able to do.
Mm, beautiful. And the last question. As someone who is invited to many conferences or summits, what do you think what makes this one stand out as a indispensable for parents and for experts like you?
I think the questions actually, in a lot of cases, we're invited to do presentations where we just do the presentation, and there's no chance to think about or to interact with people. I found these questions when you sent them quite challenging, but I think that um, they also cut to the heart of what a lot of what this is about for a parent, and for professionals to think about in terms of the type of advice that you're going to offer parents. So I appreciated the questions. As I said, I really did have to give some thought to them and to think hard about both my own personal experience with them, but also my professional experience in answering them.
And that's exactly why I'm so grateful, that you shared both of the aspects, as your broad professional expertise and deeply personal journey as a father. I think this conversation is a beautiful reminder that understanding your child unique timeline, as we've discussed it, isn't giving up on them, but giving them the space to become who they truly meant to be, and setting 10% of the baseline to be celebrated, right?
Yes,
um, Thank you so much for taking the time again. It was an honor. Thank you.
my pleasure, really. Thank you.